Welcome to Issues and Insiders. Today we address efforts by health authorities to accommodate a changing pandemic environment following assessments by world leaders in light of retreating COVID-19 tallies. For more, I have Professor Kim Moon Kyu from Yonsei University. Professor Kim, it's good to have you here.
Good afternoon.
I also have Professor Monica Gandhi at the University of California, San Francisco, live on the line. Professor Gandhi, as always, it's a pleasure.
Thank you.
Professor Kim, we'll start here. Let's start off then with your thoughts regarding the lifting, complete lifting that is, of the outdoor mask mandate here in South Korea, even for large events exceeding 50 people.
Well, it's continuously decreasing in Korea, and right now the daily tally has already dropped to about 600 cases per million, and this is the same number as a mid-February 2022, and it's declining in the speed almost same as Japan. So I think both countries are facing the end of this BA.5 outbreak. And since mid-August, the reproduction number, which means how many patients you infect, dropped below 1.0, and right now it's only 0.82. It's also just declining. So I'm optimistic, but still there should be no more new variants coming.
Right, hopefully not. Dr. Gandhi, what can you share with us about the US experience with regard to lifting of the mask mandate earlier on?
So, actually outdoor mask mandates were dropped in April of 2021. So that was some time ago. And then all indoor mask mandates, except in healthcare settings, have been dropped. And then even the healthcare settings, the CDC just said on Friday, just last week, that even healthcare settings are dropping mask mandates. And that was true in the UK about a month ago. So we're definitely in endemic management. What endemic management has to mean, though, we have to remember, is that we're never going to get rid of COVID. So we're always going to think about who needs a booster, who needs therapeutics. It's never over. And that's where these words are getting confusing. Endemic is not the same thing as over.
Right, it really isn't, of course. Professor Kim, there's also been a bit of talk here in South Korea regarding the lifting of the indoor mask mandate for children. As a pediatrician yourself, what are your thoughts on this?
Before I talk about that issue, we have to know that recently our government announced a report that the antibody positive rate is more than 97.3%, which is very high. And more than half of those are naturally infected. And if I close into the age group below 10 years of age, the children's antibody positive rate is more than 80%, and almost all of them were naturally infected because they didn't have any chance to get vaccinated. So that means, children below 10 are almost infected by natural courses of COVID-19. And they show mild course compared to elderly people. So now we talk about children mask wearing. If they wear the mask for a very long time, it might have some negative impacts on development and socialization, especially if the age is less than 2 years of age. But I think time is coming to let them go around without mask, and it's going to lead a lot of explanation and public announcements to prevent confusions.
Right. Professor Gandhi, did the lifting of the mask mandate back in the US lead to any tangible spike in community transmissions of COVID-19, do you think?
No, actually it didn't, because it was very interesting. We're a very fractured nation. And so the mask mandates were lifted in some states way before other states. For example, California was one of the last, and other states had lifted them. And you still see the same, when the variants come, you still see the same spike in cases, and then they go down. And that's likely because people get infected, they get IgA, which is the antibody up in their nose, and then transmission goes down. But there was no appreciable difference in that going up, going down. in the places with or without mask mandates after vaccination. So February 2022 was essentially when almost every state stopped indoor mask mandates. No, we haven't seen appreciable changes, even in planes, for example, which that was stopped also in April of 2022.
Right, which is, of course, reassuring to know then. Professor Kim, in line with its claim that the end is in sight with regard to the pandemic, the World Health Organization has spoken about 6 key actions that countries need to abide by to contain this virus. Could you tell us what they are and which do you believe are of utmost importance?
Well, the 6 tasks are testing, treating, vaccinating, and prevent infections happening in public places, and battling misinformation, seeking clear communications. If we can do all 6 of that, it's going to be ideal. But let's turn our watch back to the beginning of this pandemic. There was a lot of confusion and chaos and misinformations going around. So for Korea, we had a MERS in 2015, so we were kind of ready. But actually, to establish the testing methods and drug development, vaccine program, it takes a lot of time and efforts and fund. So usually new pandemic, new infections, they never behave as we expect, and it's going to be a totally new one. So you can see that there are a lot of differences if we compare Spanish flu and this COVID-19. Mistrust and misinformation sees their chance to take place, and many people sometimes risk their lives because they choose the wrong medication, not understanding the side effects. And so if I focus on personal perspective, we have to wear mask, we have to wash our hands, and we have to keep social distancing if you understand something is happening in the near future. For national perspective, we should be vigilant at the entry point, such as airport or seaport or land crossing. And the government has to alarm the general population, and they need to educate and invest on the testing facility, drug development, and critical care facilities. So actually, I cannot choose one subject because all of them are important.
Right, they really are all 6 key actions. And against that backdrop, Dr. Gandhi, US President Joe Biden recently claimed that the pandemic is over. I understand this particular remark has divided the medical community there. Could you tell us a bit more?
Yes, I mean, I think it's almost a social construct when people decide that something's over. And I think that word over really struck people the wrong way, because it is actually never going to be over, in the sense that influenza has been with us since 1918. It was with us before, but 1918 was a terrible influenza pandemic. And then after that, we've had influenza every year. And ongoing management of something, a respiratory pathogen, I think that made people bristle that he used the word over. But I think what he meant, is this phrase endemic that keeps on coming up, the acceptance that we can't get rid of it, mostly because of animal reservoirs. That's one big reason. 29 species of animals have COVID. It's always gonna come out and be around, unfortunately. But the question is, do we have the tools to manage it? Do we have the ways to keep the fatality from COVID as low as possible? And those ways are ways that have been available to us, but one is vaccines, the second is boosters, and the third is therapeutics for people who are more susceptible to severe breakthroughs, which are usually those over 65. A big New England Journal study showed those who need Paxlovid are over 65 if they're vaccinated. And those tools have to be applied. What the WHO, Dr. Tedros was saying is, we need equity in vaccines, we need equity in therapeutics, but we are going to have to live with it, because the idea of this ever going away has now been dashed.
Right, and staying with the tools that Professor Gandhi has mentioned, Professor Kim, here in South Korea, reservations with the bivalent vaccines are well underway. Now, if I remember correctly, Professor Kim, a while back you questioned whether members of the public would choose to get this particular inoculation, especially keeping in mind the reality that our Omicron, well, B5 wave is subsiding. What is your recommendation?
Before I would like to mention about those two kinds of bivalent vaccines made by Moderna and Pfizer. Moderna is a bivalent vaccine against the original Wuhan strain and BA1. Pfizer, same Wuhan strain, but it's also against BA4 and 5. So Pfizer is approved for age more than 12 compared to Moderna, age more than 18. What is the purpose of vaccination? Is it to prevent infection or to prevent severe cases? Unfortunately, it showed that to prevent infection was not working properly. But still, FDA says that those bivalent vaccines can prevent severe infection, prevent hospitalization and death. Studies in the elderly group usually tell that after the vaccination, the antibody titer drops more earlier compared to younger age groups. So, what is the area that? What are the groups that can benefit from those bivalent vaccines? At least those bivalent vaccines can have a role in the people who are not infected with Omicron. I mean, who are not infected with COVID-19 or infected with previous variants such as Delta or Alpha or whatever. And even who are infected with the Omicron, I think those bivalent vaccines can prevent maybe reinfection or patients getting severe and hospitalization. I think that will be the role for bivalent.
Right, I see. And Professor Gandhi, what can you tell us about the response to the bivalent vaccines there in the U.S.?
Actually, there's been a relatively low uptake of the bivalent vaccine. It's about 2% uptake so far since the FDA released the BA4, BA5 bivalents. I think part of the reason for that lower uptake is that we haven't sorted out in the U.S., like Dr. Kim just said, what is our strategy for boosters? And what the WHO is focusing on is the prevention of severe disease. It is not going to be possible with boosters to prevent all infections because actually intramuscular boosters do not give as high a level of antibodies in this region, in the nasal region, the IgA antibodies. We will need nasal vaccines for that. So because of that, since we are focusing on the prevention of severe disease, most countries are actually really trying to stress the need for this in older populations because, as we were just speaking of, older populations are most likely to get severe disease if their antibodies are down. So I think that countries like Canada that are focusing on their older populations for bivalent boosters are doing better than here in the US, where it was sort of blanket. To keep it simple, the idea was 12 and up. But I think that we should be focusing on our older populations at least 16 above.
Right, I see. And in the meantime, Professor Kim, I understand this may be a tough question, but health authorities here have spoken about an endemic phase of COVID-19 next year. Very briefly speaking, what are your thoughts?
Well, the definition of endemic is that the infection is consistently present, but in a limited to a particular area and spread predictable. I mean, we can expect how they are working out. Just as the previous human coronavirus we had in winter times before this pandemic. If there's no more variant, endemic phase may even come sooner, but endemic does not mean that COVID-19 is going to be harmless.
Right, of course not, right? And Professor Gandhi, what are your thoughts with regarding prospects, that is, of an endemic phase of COVID-19?
You know, the acceptance of endemic phase should never be saying we're giving up. I think this statement, and words mean a lot. And this end is in sight does not mean we're giving up. I think what Dr. Tedros is trying to say, that we are at our lowest rate of deaths since March of 2020. So the pandemic, March 11th, 2020, was the first date that the WHO declared this a pandemic, a very significant day. And we are now nearing the number of deaths at the very beginning of the pandemic for the world. And so you can say the pandemic or the emergency phase is over. We're going into endemic management, but that never means giving up. And we will be boosting older people. We'll be using the bivalent, hopefully not bivalent, actually. I think we need to make them so they're totally directed towards the variants that are circulating. We will be always thinking about antivirals for our older patients, but it does mean going back to normal life in terms of the questions of the mask mandates that you're all discussing, and also focusing on which populations are most at risk, which are older patients, and the young have had a lot of restrictions for the last 2.5 years.
So we need to remain vigilant.
Yeah, it's always going to be vigilant. Believe me, we're very vigilant about influenza.
Right.
The public do not know that, but we're thinking about influenza every year. And so influenza shots, so we have to be vigilant.
Right, we do. All right, Professor Gandhi, as always, thank you very much for your time and your thoughts. And Professor Kim here in the studio, thank you very much for your insights.
Thank you.